first tonight at 6, hit hard by the flu. You are not alone. Flu season has not even hit its peak yet, but the illness is packing a punch. Good evening, everyone. I'm Sarah Carlson.
And I'm Eric Franke. The flu typically doesn't spike until February, but now in just the first week of January, doctors and pharmacists are staying busy. And News 3's Margo Spann talked with the state's influenza coordinator, who says there is still time to get a flu shot. Margo?
Absolutely. They're still encouraging folks to get that. Now, while you can still get that flu shot this year, not every strain is covered. So far, about 80% of the flu cases reported in Wisconsin are covered with the vaccine. Fever and body aches are hitting Rock County with a vengeance. Dr. Jay McNeil with Mercy Hospital says they saw their first case of the flu more than a month ago.
I've seen it pretty widespread, and have actually had to admit patients to the hospital in their 30s and 40s with it.
Dr. McNeil says flu symptoms usually come on like the common cold: headache, chills, sore throat, but the fever and body aches are somewhat unique to the flu.
Patient volumes are up about 50% at some of our urgent cares and about 30% at our main hospital, and most of that uptick is flu.
There's been, unfortunately, some flu-related deaths in nursing homes in elderly patients. We've also had one pediatric death in Wisconsin that has been reported.
And this year, it's already worse than last year.
We have 660 hospitalizations in Wisconsin, and at least another 40 or 50 that are being reported today, so we'll be up over 700. That's over double than what we had all of last year.
State Health Department officials say there's ample supply of the flu shot, and there's still time to get one.
Peak activity has not happened yet. It's going to get worse before it gets better. This is the time to get the vaccination.
It's never going to be 100%, but it's certainly helping. And the people that are getting the flu that have the shot, to me, they seem like it's not as severe.
Now, the doctor also recommends staying home, isolate yourself if you're feeling sick, because you don't want to pass that bug on to others. And if things aren't getting better, you should see a doctor. He says the prescribed medications may not be as effective if they're not taken within the first few days, so it's better to head to the doctor sooner rather than later.
We certainly are hearing a lot about it.
Absolutely.
All right. Thank you, Margo.